This is a great exercise for the core. This is a great core exercise. How often have you heard that? Interesting. I've been an exercise professional now for going on 40 years. And the first 30 years, around about, give or take, I've never heard of the term core unless it was in reference to an apple. And I guess essentially core of an apple and core of the body is probably something around about the same thing. However, if I ask you this question, when you say this is a great exercise for the core or this is a great core exercise, let me ask you this question. Define the core. What is the core? And you probably find a variety of explanations with lots of mumbling and pauses and ums and ahs in between, because the core has never actually anatomically been defined. I've never read it in a atlas of anatomy anywhere whatsoever. I've never actually heard of it outside the fitness profession or the industry. I haven't heard it in the anatomical world. However, it's been said so much, now it's become a fact that people cannot even define. So what is the core? Where does it come from? Well, the core, first of all, it's a industry term. It's been, I guess, created or made up by the industry to probably justify an exercise or an exercise movement that creates a reason to do that exercise, and this is the benefit. It's going to improve your core. But what is the core? And you're going to get a range of explanations, as I said. I guess if I go back, and I'm going to share my view, but I'm going to try to stay as close to anatomy as possible. Anything outside that, I'll explain that that's probably my opinion. But you know what opinions are like. Everyone's got one, and most of them smell. However, so if you go to anatomy and how the body's broken up, and I guess a lot of people talk about the core and they're referring to the core, like the core of the apple, the centerpiece of the body, which is probably this part here. What exactly is that part? If I shed all the muscles off and organs, and what are you going to see? Maybe from the back view, it's this part here, the core. To stabilize the core, to do what is another great question. This is great for core stability. To do what? There's a great question. To do what? And see what explanation. First of all, define the core, then ask this question: to stabilize the core, to do what? And see if the two movements sort of match each other or overlap to one another. But that's something I'm going to be talking about more of. But if you look at it from an anatomical point of view, from a skeletal point of view, the body is made up of the skeletal system, which has many purposes, from production of red blood cells to the storage of minerals such as calcium and phosphorus, to obviously creating a basic framework and an attachment for muscles, levers, so muscles can pull and create movement. So yes, the body is designed to move. Now I want you to imagine that you have your X-ray vision goggles on, because whenever I look at an exercise, I always put my X-ray vision goggles on and I see past the muscles, I see past the organs, and what I do see is the bones, I see the joints, I see the cartilage, the meniscus, I see the synovial membranes, I see the ligaments, and I see the tendons, because that's going to give me a great idea of what's happening underneath the movement, to see what is it actually doing, whether it's going to be beneficial or possibly detrimental. So the body is made up of the skeletal system, and that comprises, and that's generally from an anatomical point of view, broken up into the axial system and the appendicular skeletal system. Now the axial skeletal system is basically probably what people refer to the core, even though I don't think people really know what they refer to when they say that term. But I'm going to step in and make a slight justification for them, even though some people might be a bit more definitive of their explanation and their definition of it, and other people are more general. So the axial system comprises of the vertebrae, the spinal, the spine, the vertebrae, all the vertebrae up and down from the cervical vertebrae all the way down to obviously the coccygeal vertebrae, and the ribs, the sternum, and obviously the head sits on top of that as well. So that was what we call the axial system, which is really the system of the trunk, what you probably call the trunk of the body, the trunk of a tree, and you have the branches of the tree. The trunk is the axial system, and the branches are the appendicular system. The trunk of the tree is the core, even though it hasn't been defined, but I'm going to assume that's what they're referring to. And the branches are the limbs that create the movement. And we try to keep this part nice and stable, because like a tree, the trunk has to be nice and stable, and so the limbs can grow out there and create foliage for birds to make nests in their tree and bees to share the pollens of the flowers and all sorts of wonderful stuff. But ultimately, when the tree is under stress through the environment, through wind, it's a windy day here, you probably hear a bit of wind in the background from storms and rain and all sorts of stuff, the core, the trunk, you want to be nice and strong and stable so it survives the time, so the branches and the leaves and the flowers can survive and thrive. So there's a good little explanation of maybe what the core is. Now the appendicular system, or the branches of the tree or the limbs, are made up of girdles. Now, not a girdle you wear for the ladies, girdle which is like a platform. So a girdle in the upper body is the scapula here, which is people refer to as your shoulder blade, but it's not really. It's the anatomical term is your scapula, and the long bones that really come off it. Because obviously in the upper body will be the humerus, will be your radius and your ulna, your carpals, metacarpals, and your phalanges. And in the lower body, the girdle is the pelvis, which is really a platform like the scapula, and then you have your femur, then you have your tibia and your fibula. Obviously on front there you have your patella, and then down in the feet you have your tarsals, your metatarsals, and your phalanges. So let's assume that core has something to do with the axial system, the trunk, the core, the apple, the body here. We want to keep this nice and stable, so I can use my limbs in a very strong, efficient way with a good, strong, stable base to run, to jump, to throw, to kick, to punch, to climb. And obviously a lot of possible injuries that apply. In the site of the most common injury, soft tissue injury, is the lower back, which is basically the lower back is the most common site will be L4, L5, lumbar vertebrae 4 and lumbar vertebrae 5, that intervertebral disc, that's the, and then underneath that L5, S1, which is lumbar vertebrae 5, S1 is sacral vertebrae 1, and that they're the two main, probably most common injuries in the lower back. So people, I guess, want to strengthen the core, whatever that means, strengthen the core. First of all, what does strengthen actually mean? Are you strengthening bone? Are you strengthening cartilage? Are you strengthening ligaments? Is it muscle? What does the word strengthen? That's another very broad concept. So I guess, what we want to do first is really define exactly what makes up the core. So, for example, if I use another example, hey, I want to strengthen the shoulder. Okay, so what does shoulder mean? I want to strengthen the shoulder joint. Well, do you strengthen the joint or the muscles around the joint? Is the measurement of strength means force output or recruitment of motor units? Is it muscle size, or is it control? Is it strengthening the stability, or what joint? So first of all, if you say shoulder, you first have to define what shoulder is. I want shoulder strength. Okay, well, what is that? How is that measured? So you may come out of this session with more questions than answers, but at least you're thinking, because a lot of time people will become an expert in someone else's opinion, and their opinion came from someone else's opinion. It came from someone who just made something up, and before enough people say it, it becomes true. But what I do know, because everyone is saying it, doesn't mean it is true. Because there was a time where everyone thought the earth was flat, and we know that is not true, but back then everyone believed it, therefore it became factual that it was flat. So if I say shoulder, what is the shoulder? What anatomically makes up the shoulder from a skeletal point of view? Well, the shoulder, is this. There's my shoulder. So what is the shoulder? Strengthen the shoulder. Well, first of all, let's have a look at the joints of the shoulder before we even look at the muscles. And I'm using this as a parallel comparison to core, but core I think is even far more vague than the shoulder. So the shoulder is made up of, well, you've got the girdle, which is the scapula that sits onto the back of the thoracic spine, right, on the ribs. So that's your scapulothoracic joint, which is like a fibrous joint. And that's the shoulder. See, I can move my back and forth, my shoulder blades back and forth. That's the scapulothoracic joint. So are we referring to shoulder as that joint, or referring to the movement of the humerus about the glenoid cavity? That joint here is called your glenohumeral joint. That is a synovial joint. It's a shallow joint that has lots of mobility due to the necessity of the upper limbs to grab things and move things and build things, and all. So it's designed for mobility, not necessarily stability, but hence the very shallow cavity as compared to the acetabulum in the hip joint, which is a deep cavity because it's a weight-bearing joint, where this is more of a joint for mobility and movement and moving things around and making things and creating things and all sorts of stuff. Still needs stability, but its architecture of the joint is designed in a way for mobility, not so much stability. So the shoulder joint really consists of two joints, the scapulothoracic joint and the glenohumeral joint. So if you're saying I want to strengthen the shoulder joint, which one is it, or is it both of it? And if you do define one, say you define the glenohumeral joint, okay, so what muscles move the glenohumeral joint? Because every muscle that moves the glenohumeral joint, or the humerus for that matter, has a contributing part towards stability of that joint. Some more than others. Normally the muscles that are deeper in the joint are closer to the origin and insertion, that are closer and deep in the joint have a greater role in stability, where the muscles that insert further away from the joint have a greater role in movement. So if I look at the shoulder joint, I'm not going to go too much into this, but the shoulder joint, the deeper ones, which will be more involved in stability of keeping the head of the humerus into the shallow cavity of the glenoid cavity, are going to be your rotator cuff, which is your supraspinalis, your infraspinalis, your teres minor, and your subscapularis. I'm not going to go into them. But they involved in a little bit of rotation naturally, but also they're very much involved in stability of keeping those two articulating surfaces together. Then you have the muscle on the top, which inserts further away from the two articulating surfaces, called the deltoid, which originates on the part of the scapula, the acromion process, and the spinal scapula, inserts into the obviously the proximal lateral humerus. Now that muscle is going to be more involved in movement of the humerus, but it also has a contributing role to encapsulate the glenohumeral joint to help in stability. So that's also a stabilizing muscle. It's also a mover, an agonist, where the rotator cuff is more of a stabilizer rather than an agonist, which is a muscle that's responsible for the movement of a joint. But many times they can be both. They can be an agonist and be the pro mover or the assistant mover. They can also be a stabilizer and a synergist muscle, which I won't go into. But they also have other muscles that move the humerus, such as the pectoralis major. That moves it, because the pectoralis major originates on your sternum, and your clavicle inserts in your anterior proximal humerus. So that moves it. So therefore, that's going to have a role in guiding the glenohumeral joint, and will have a role to an extent of stabilizing. If I get a push back this way, like that, it's my pectoralis major that stabilizes it. If I want to hold my arm there and push something like this, okay, I'm pushing something, and I'm pushing, my pectoralis major isn't moving, it's isometric, but it's also helping stabilize the glenohumeral joint so the head of the humerus doesn't shift back in the joint, because it's a strong force, and it's going to have a coupling effect with your rotator cuff as well as your deltoid in a cooperative manner. So they all contribute. One's going to contribute more to the generation of force, one is going to be a bit more detail in the fine-tuning of the stability and position of the joint, and they're all going to have a role in positioning, whether that be in a stable position or a static position or a dynamic position. You also have a latissimus dorsi. Latissimus dorsi also inserts onto the humerus. So latissimus dorsi is going to have a role. Yes, it's a strong prime mover, a strong, powerful moving muscle, but it also will have a certain role in stability. So now we define the joint. Now we say, okay, well, what muscle are you going to be focusing on, and what movement pattern do you want stability in? Is it stability by doing a push-up? Is it stability by scratching my head, or throwing a ball, or stability by wrestling, or stability by climbing a tree, or stability by any shoulder move? Because this shoulder can go everywhere. So stability in what plane of movement, what movement pattern in itself. Not to mention the scapulothoracic joint. That also you say, well, do we need stability there? So to stabilize the platform or the base of a crane, for example, think of the platform, the scapula is like a base of a crane, and the humerus and the radius minor is the arm of the crane. You need to have a nice stable base for the arm to be able to pick up loads and move them around. So what stabilizes the scapulothoracic joint? Well, you've got numerous muscles, the trapezius, you have which originates on your transverse processes of your vertebral column, your thoracic vertebral column, that then pans out to your spinous scapula. You have your rhomboids, which originates on your spinous processes of your vertebrae that insert onto your medial border of your scapula, which is more retraction and downward rotation. Trapezius is going to be obviously traction and elevation and depression, as well as downward rotation. And upward rotation as well, or lateral rotation, medial rotation, not to mention serratus anterior also inserts. So any muscle that inserts, doesn't originate, but inserts onto the trapezius has a role in moving it, as well as stabilizing it in a cooperative way with all the other muscles. So I'll need shoulder stability. Okay, so which one is it? Is it obviously ideally it's going to be the both. It's going to be scapulothoracic stability while having glenohumeral stability, doing what? For what particular movement? So what do you do? So I need to do rhomboid retraction exercise, that will improve stability. Or I need to do rotator cuff exercise, would that improve stability? Well, now you're training one part of many parts that won't necessarily translate into all the other parts working in a holistic way, in a coordinated way, in a synchronized way, because movement is very synchronized. It involves lots of muscles working together, tying together to create a movement, but also to have stability in that movement. So stability doesn't come from one joint, it doesn't come from one muscle, it comes from a group of muscles that works together, and that is very specific to the movement pattern that you're trying to develop stability for. I'm very stable in lots of things, but there's things that I don't practice I'm not very stable in. Interesting, isn't it? I'm very stable in doing sort of martial art kicks because that's what I do, but if you put me on a tightrope, I'll fall off because I haven't trained the stability specific to that movement pattern. So just because you have stability in one exercise doesn't mean it's going to translate to a completely different movement pattern in a very different position. So let's get back to core, but I use shoulder joint to maybe open up your mind of, yes, even though we talked about shoulder, which is something we can understand, which we probably have a better knowledge of from an anatomy point of view and a movement point of view, but now we open up the core. So what makes up the core? So what are the joints that make up the core? Well, first of all, a lot of time people will probably refer to your vertebral column. So your vertebral column is your cervical spine, your thoracic, your lumbar, and your sacrum. Now your sacrum is fused together, so there's no movement in the sacrum. So they're fused together, and then you have all the individual joints of each vertebral joint, which is separated by intervertebral discs. So each of them is a separate joint. So you have all these different joints, and it's not one. The vertebral column is not one joint. It's a whole series of pieces of Lego attached on top, but each piece of Lego has like a little balloon in between that moves around. So each one is an individual joint. That's why you probably get more injuries in the lower back, L4, L5, L5S1, because that's the bottom that has to support the rest. That's the biggest weight-bearing joint. Therefore, it's more prone to wear and tear and impact. That's why the vertebrae at the bottom is thicker, bigger vertebrae, less movement, and at the top they're smaller but more movement, because the top is more designed for mobility and the bottom is more designed for stability. So which joint are you trying to stabilize? It L4, L5 or L5S1? Is it T1, T2? You have 12 thoracic vertebrae. Which one of the 12 are you targeting? Well, obviously you're going to be targeting the whole group. So first of all, you have to acknowledge that they're all these individual joints. And those joints are what we call cartilaginous joints. So there's actually a bit of movement between them, a little bit of movement. So generally it's the joints that have movement require more, I guess, conscious stability, because a moving joint with movement in it is more susceptible, because you increase a bit of mobility, you decrease the stability. There's an inverse relationship. The more the mobility, the less the stability. That's why the shoulder joint has lots of mobility but not a lot of stability, where the hip joint has lots of stability but not so much mobility. And not to say that some people can develop that mobility, but they'll probably over time compromise their stability of that joint. You can't have north and south at the same time. There's going to be, one goes from the other. So when it comes to your vertebral column, the cartilaginous joints is a bit of movement. Then you have the other parts that make up the axial system, which is your ribs, and they sit onto your sternum. So that's a fibrous joint. The fibrous joints have lots of stability. They're supported by ligament, and they're designed for stability, not mobility. So you don't say, well, I'm going to go and increase my rib stability. There's no need to, because the architecture of the joint with the ligaments around it give you that stability. It's like the joint between your sternum and your clavicle. You don't need to, I've got to increase my stability of my clavicular sternal joint, my sternoclavicular joint, or my acromioclavicular joint. I need to increase the stability there. You don't have to increase stability there, because it's nice and stable, because it's all wrapped with ligament, and it's not designed. There's maybe a little bit of movement, but it's not designed for mobility. So you look at all these joints, they don't necessarily need a lot of stability, because the design of the joint gives that stability. That doesn't mean they're not prone to injury. If I land and have a huge amount of force go through my shoulder joint, then I might break a collarbone or something like that, or get a AC joint injury, but that normally comes from a traumatic event, or lots of wear and tear, which I won't go down that path. But they're not the joints that you're targeting for your core exercise. So really, in the axial system, the only real joints in the axial system that you could target to increase stability of the core would be the target of the obviously the vertebral joints. And obviously you can't just ignore the appendicular system, because they all work together. The appendicular, the pelvis, you move the pelvis, then that pelvis is going to have effect on your lower back. So if I anterior tilt the pelvis, the pelvis, and that's going to cause a lordotic curve in my lumbar spine, and that in itself is going to cause some posterior pressure on the end of the vertebral disc, particularly in the lumbar spine, and that would tend to push the vertebrae toward, or the disc towards the anterior part of the joint, and that could over time cause some injuries. And again, I'm not going to go down there. On the opposite, if I do posterior tilt, that's going to flatten my back, as apart from anterior tilt causes lordosis. Anterior tilt causes flat back, that causes anterior compression on the intervertebral disc. If that's maintained with stresses or repetitive stresses over time, that can cause some wear and tear, because that's going to push the vertebral disc more towards the back, causing your nucleus pulposus, which is a gel-like substance inside the disc, to push toward against the annulus fibrosus, which encapsulates the disc, and that can cause cracks through the vertebrae, and that could push it into a prolapsed disc, a bulging disc, a slip disc, a herniated disc, and I'm not going to go to each one of them. But that position, that poor joint position, can cause unequal forces through the joint that can lead to long-term injuries, whether it be chronic or acute. That means they're good-looking, not necessarily, but acute means they happen quickly, they're short-lived, but the chronic ones are the ones that are from poor postural positions. And poor exercise positions can certainly accelerate that as well. So again, I guess what I'm asking you to do is that before you use the word core, you have to ask yourself, do I really know what the core is made up of? Is it made up of what joint is it? Not to mention we go into the muscles. Because even the pelvis, the appendicular system, the pelvis can have an effect. The scapular position can have an effect. I go into rounded shoulders. My scapula is now from here, it's been protracted, or it's been abducted. That in itself pulls me forward, and that can have an effect on my vertebral column, my thoracic. So I go into that more kyphotic position and poke neck position. That causes, again, unequal forces through each of those cervical spine or the thoracic spine can also lead to wear and tear, degeneration, and all sorts of challenges associated with that. So yes, you can't just work one without the other. It's no use training the core if you, whatever the exercise is, if the other parts of the body are in an inappropriate position or a compromised position, because that could backfire on you. So if we say, okay, what makes up the core? Well, here we go again. It's interesting, isn't it? I guess a lot of time people refer to it maybe more the lower back, I suppose, the core being down here, somewhere down here, which really means your lumbar spine and maybe your pelvis. Because your pelvis has an effect on your lumbar spine, whether you're causing anterior tilt, posterior tilt, and even lateral tilt, where the pelvis pops out to the side. You don't have good lateral stability. So what muscles now control those? Well, there's a plethora of muscles that we can choose from. You know, people say it's not just one. It's not abs. Abs isn't a muscle. That abdominis, rectus abdominis is one muscle, which is, as we know, down here, which originates on your crest of your pubis and inserts onto your sternum and ribs, and that's mainly a muscle that's responsible for trunk flexion. But it's not even close to the lower back. It's right at the front here, isn't it? So you can't really say that's going to be a great stabiliser for your lower back, because it's not even in the general vicinity. But everyone focuses on, I've got to work core, doing crunches, and so, you know, do some sit-ups, and I've got to work this here. But really, what are you trying to work on stability? Here. Well, that doesn't make any common sense to start with. Does it have a slight role in maybe stability of the lower back? Yeah, like slight role, like my pectoralis major has a slight role in stability of my glenohumeral joint, but nowhere near as significant as my rotator cuff, which are very local. They're local means they're right in the joint, rather than global muscles. You know, so local muscles, local stabilizing muscles are close in the joint, fixing or helping to stabilize the two articulating surfaces, so the big global muscles can move the limbs around accordingly. So again, this is the abdominals, or rectus abdominis, is probably more of a global muscle rather than a local. So rectus abdominis, not going to be high on the choosing pole, even though it will be involved to some degree. You have your internal and your external obliques, which originate on your ilium and insert onto your ribs. You know, and the other one does the opposite, but these are ones go all the way around the side here. So again, they're going to be involved in, obviously, yeah, lateral flexion, and they're involved in flexion and extension and rotation. Again, they're more global, but they do have probably more of a control over your pelvis. They're going to have, because they're like a weight belt, they go all the way around. So they're going to have a certain role in control of your pelvis. So they're going to have a more active role in indirectly stabilizing your lower back, not directly, because they don't insert onto your lumbar spine. They're not on the vertebrae, yeah, they're on the pelvis. But the pelvic position can have an effect on the vertebrae. So it's really important to understand that it's an indirect effect that works cooperatively with rectus abdominis, internal, external obliques. Then you have your erector spinae, which is going all the way up and down your vertebrae. And again, that's the muscle that's going to be involved in extension of the trunk, rotation of the trunk, lateral flexion of the trunk, anything to do with the trunk. So yes, they're very much an action muscle as well, and they're going to have a cooperative role in stabilizing those joints as well. So I'm going through the muscles now that you have to consider, but they all work together in a cooperative way, in a synchronized way, from a neuromuscular point of view. It's not just the muscle strength, it's how they're fired at the timing of the fire. It's like the cylinders of a car. If they're out of sync, the car doesn't function, doesn't go very fast. It needs to be tuned to do what it needs to do, not in a movement pattern which is unrelated to the lifestyle or the function movement that you're trying to increase stability for. Then you've also got quadratus lumborum. Quadratus lumborum is at the deep at the back here, and that's going to be flexion, lateral flexion, as well as extension, which originates on your pelvis and inserts onto your lumbar as well as your ribs. So that's going to have an indirect role, but that's going to be more global, not local. It's not a deep stabilizer. You have your transverse abdominis. So your transverse abdominis is the muscle that pulls your belly button in. You know, in the army say, pull your tummy in, like that. You hold it in nice and there, upright, rather than having a little saggy tummy where it pops out. So this is what we call a muscle that causes the hollowing or the drawing of your abdominal cavity. So this one here originates actually on your vertebrae, and it comes around and inserts onto your linea alba here on the inner lining of your abdominal wall, and it has many other different parts as well. But basically, it pulls it in. So it's really like it pulls your belly button in. So the good thing with this one, this is more local, because the activating of that actually starts to pull the vertebrae together and destabilize it. So this is really what we call more of a local. So transverse abdominis is a deeper local muscle because it's deep and it pulls the abdominal region in, and it helps stabilize because it attaches onto each vertebrae, transverse abdominis, the transverse processes, and it starts locking it in. The other good thing it does is actually draws everything in. So when everything's drawn in, it creates a better alignment of line of pull of all the other muscles, from your rectus abdominis to your internal or external obliques. If you let your belly pop out and you feel your obliques, they relax. But if you draw your belly in, your obliques activate. Quite interesting. So that muscle could be a very important muscle to draw in, to not just activate it to stabilize each of the vertebrae in your vertebral column, but also to align your body in a good postural position to get co-activation of all your other global muscles that are a part of the stability of the pelvis and the lower back. And then you have a deeper muscle called your metaphysis. And your metaphysis is a deep muscle that originates and inserts between each of the vertebrae. And that one is very much local. That's like the rotator cuff. It's right in the joint, and it locks or helps lock and stabilize each joint individually. And that goes all the way up and down the spine between each of the vertebrae. What's interesting is it's been found that when you activate your transverse abdominis, they get all that co-activation. You also get co-activation of your metaphysis muscle that tends to lock each of your vertebrae, stabilize each of those vertebrae. So if your muscles, if you don't have that control, each of the vertebrae, there's going to be some subluxation in there. It means there's going to be a bit of movement between each of the vertebrae. So if you don't have good posture, activate your transverse abdominis, not get co-activation over the other muscles, every time you move there's going to be this little movement between each of the vertebrae, which cause wear and tear, particularly when you start to laterally flex and circumduction and all sorts of movements and rotation. You got this joint not quite stable. But if you start to co-activate everything by initiating by activation of your transverse abdominis, your co-activation internal external obliques, your rectus abdominis, your rectus spinae, your quadratus lumborum, and then very locally your metaphysis. So all of it starts to activate nicely together, but it's initiated from good posture to start with. You've got to get your joints in the correct alignment. If your joints are not in the correct alignment, the muscles aren't going to fire correctly. Because and when you do overload them, you overload them with the joints in the wrong position. Don't overload the muscles with the joints in the wrong position, irrespective of what your body position is. We're talking about joint position. So I guess I'll use this analogy with using a weight training belt, which we used to do in the old days when I was a young crazy bodybuilder. We used to use a weight training belt for back stability. So the belt itself is made up of naturally your rectus abdominis, your internal, external obliques, as well as your quadratus lumborum. So that's what makes up the belt. That's the physical structure of the belt. Now, to get that belt working properly, I need to pull the belt in. I need to pull the belt in, and that locks it all into place. So when I pull it all in, that's your activation of your transverse abdominis. And then I clip it in, and that's your metaphysis that locks each of the vertebrae in. So when I do an exercise, whether it be back in those days, when I don't do it anymore because I use my internal weight training belt, which is the muscles. Because sometimes if you rely on external support, you start to lose control of the internal support. One or the other. So how about get rid of the external support and use the internal support, your internal weight belt, which is all these muscles. So, but when I use the weight belt, I use it for bench press, I use it for squats and lunges and deadlifts and all sorts of stuff. So it didn't matter what the exercise was, I used the same belt. So the same applies with maybe what you call your core, which is a cooperative of all these muscles. I've named about seven or eight of the muscles so far. And so it's not about the exercise, it's about activating those muscles to do the exercise. So, because those muscles are important in all movement, whether it be running, jogging, jumping, kicking, throwing, wrestling, football, squats, lunges, bench press. You need stability through this whole section, no matter what you're doing. And so the exercise doesn't determine whether it's a core exercise, because every exercise is a core exercise. Every exercise is a core exercise. So then you say, okay, I want core strength. For what? What do you need core strength for? And normally people say you need core strength for life or for function. But if you're looking at functional movement, most functional movement is in what position? The upright position. So what I design a core exercise on the ground to train those group of muscles that function in the upright position under very different circumstances, because I'm not a lizard. If I'm a lizard, yes, I might probably do some exercise in the lizard position, which might be like a plank. A plank is a classic example that's been very much attached to a core exercise, probably more so than any. But again, a plank is like the core. It's a new exercise. It didn't exist back in the day. But all of a sudden, they've branded it. They defined this is a core exercise. So if you look at the plank, if you look at the body position of the plank, unless you're a lizard, how's that got to do with anything to do with life or function or sport in the plank position? So first of all, the body position is down when I function in the upright. What I go on the ground to train my muscles that function upright. I need to stabilize my vertebral column in the upright position. And what is the best position to train my muscles to stabilize the vertebral column in the upright position is to do an exercise in the upright position. Because not only are you going to be working the muscles, you're going to work the muscles specific to the exact joint movement, the exact line of gravity, to the exact synchronization of muscles to stabilize joint in that position. Because it's going to be a very different firing of the muscles and a very different role of the muscles in a plank position as it is if I'm playing football, playing tennis, or moving rocks around my garden. So I'm doing an exercise which is dysfunctional in body position. And then if I look at most people when they do it, it's static. Life isn't static. They sat there and they stayed there like a frozen lizard. How long can I hold it? And they define the significance of that exercise by how long they can hold that static isometric position that's supposed to give me benefit in a upright, dynamic, concentric, eccentric, isotonic type movement pattern, but I'm training it in a muscle contraction type which is not relevant to the way I perform or the way I live. And the joints are not in the correct position. If you look at the pelvis, I use one joint for example. The pelvis ideally should be in a slightly anterior posterior position in the upright position. But if you look at when you go into the plank position, that pelvis is not in that same position. So there you're not actually training against any particular load. The pelvis is just trying to hold itself, and the load is going this way. If I'm in a plank position, the load is going that way because gravity is pulling that way. So I'm in this position, and the load is going across the joint. So the line of load is perpendicular to the line of load I experience in functional movement, which is the line of load is this way with me in the upright position. So I'm more experiencing compression forces with some slight, obviously shearing and flexion and rotation forces, but going into a plank position is purely load, isometrically, statically, shearing force. And I'm holding myself in that. So my joints are not in the correct position. My body's not in the right position. My joints are definitely not in the right position. Because if I look at the x-ray of the vertebral column, someone doing a plank, it's not exactly the way it should be as in the upright position. It's been compromised in that position. Even my shoulders are rounded, my elbows forward, my head's poking forward. So all of these joints are not in its correct postural position. It's been compromised by doing a dysfunctional movement. It's not even a movement, it's a static position. So the body's in the wrong position, the joints in the wrong position, the load is in the wrong position, and now you're throwing in the muscles in the wrong position to develop core strength that you can't even define. So ideally, that's not going to be a very specific muscle or exercise for core. Yes, if you're going into the world planking competition championships or the local planking competition championships, or when you break a Guinness Book of Record because you want to know how long you can hold a plank. A lot of people test how long they can hold their breath underwater to win an award, but it's not really functional. But it's gimmick, I suppose. Then but when you're doing that for your life or for your sport, all the boxes remain empty. If anything, there's a cross there rather than the tick. Sometimes it can be actually contradictory to the health of your body by doing such an exercise, even though it's not heavily loaded, but it's repetitive if you do it a lot. So I guess the message here is there's no such thing as a core exercise, because every exercise works the core specifically to the movement pattern of that exercise. So when you select an exercise to work the core, don't select an exercise to work the core. Select an exercise to work the function that you want to develop, or the movement pattern that you want to develop, or the position that you want to develop, or the performance for that position, or the performance for that movement that is relative to your goals. And in the process, doing that movement pattern, you would train the core anyway, specific to that movement pattern, to that body position, to those joint movements, to those muscles activation, to the specific load patterns that apply to that movement, to the speeds of those movements, to the loads of that movement. So people will tend to want to think this is the magic bullet. There is no magic bullet to a very complex core, whether it be shoulder, I want to work the hip, I want to work the shoulder. Yeah, wait a minute, you just work the body. Work the body in the position that it's designed to work, in the movement pattern that you want to improve on, with maintaining great posture, great joint position, great movement pattern, with appropriate load, and then you'll get the appropriate firing of all the muscles, whether it be the global muscles or the local muscles, to get the right outcome, and stop wasting your time spending time on exercises that are really taking you off the path rather than accelerating you on the path. So hopefully that's been thought-provoking for you to think about what you're doing and what you hear, and ask yourself this question. I want to work the core. For what? For running? Then what's the best way to work the core for running? Is to run. And if you're going to do a loaded exercise in a controlled manner, then do an exercise that's going to be relatable to running. First of all, running is upright, so maybe choose an exercise upright. Running is using one leg at a time. We'll pick an exercise which is using one leg at a time. So now we got down to maybe doing, instead of squats, maybe lunges. And correct the right position. Don't compromise your position when you're doing the lunges. And pick the load to work those muscles in that upright position. On a unilateral type exercise, we can increase the load, and during that exercise, such as the lunge, control the pelvis, the lateral stability of the pelvis, control the anterior posterior tilt of the pelvis, control the lower back, the shoulders, and everything can work the muscles, the whole body strong, and then everything will get strong. Your prime movers, your assistant movers, your stabilizers, your synergistic muscles, as well as the global and all your local muscles, including all the muscles of the core, whatever they may be. But if you work it holistically, you get all the individual specific progressions that's going to make you overall increase your performance. So, food for thought. I'm going to go and eat some food now. See you in the next Kmax.